It's time to put your health in your own hands. Get ready to learn from today's top health and wellness innovators and thought leaders on Optimal Health Radio. Now, here's your host.
Hi, everyone. This is Tammy Patzer, and I'm really excited to introduce today's guest, Dr. Anne TRUONG. Anne is the author of the international best-selling book, Erectile Dysfunction Fixed, and she has helped thousands of men to ease erectile dysfunction, known as ED, and enjoy intimate relationships once more. Her treatments involve platelets-rich plasma, PRP, which uses the body's own blood and innate healing abilities to mend injuries and treat ED. She was personally taught by Dr. Charles Runnels, the inventors of the Priapus shot, or the P shot, used to administer PRP. She has found this method to be a natural alternative to widespread ED remedies without the lasting side effects of many existing medications. In addition to treating patients for erectile dysfunction, joint pain, and spine discomfort, Dr. TRUONG also teaches other doctors to effectively use the PRP technique. So, welcome, Dr. TRUONG. Tell me more about your book and how you came to write it.
Right. Thank you very much for having me on the show, Tammy. It's my honor to be here. Well, regarding my book, it was a passion of mine to address this topic. I'm actually a physiatrist. I'm actually kind of like a non-surgical orthopedic medicine doctor, but I treat a lot of men. So I see a lot of men for pain conditions, but along with that, they also have ED issues, and almost all of them, anyone over 60, has some type of ED. Right now, there are 38 million U.S. men with ED, and that may be even underreported number. So it was a natural progression that when I was treating my patient with platelet-rich plasma for their pain, that I wanted to learn how to use platelet-rich plasma to treat erectile dysfunction, and that's how I came to learn from Dr. Charles Runnels, who is the inventor of this procedure. What platelet-rich plasma is just using your own blood to heal yourself. And your own blood can help heal an injured area like a shoulder injury or arthritis, like the arthritis in your knee or your hip. But it can also help repair the damaged tissue that are in your genitals. So it's a natural alternative. So I wanted to write the book to let men know that, and their loved ones and their family know that there is an alternative besides just taking a pill or surgery to treat ED, because we're looking at least 30 million men that suffer from this condition at this point. And some may not know that there is a treatment. And my point that I want to stress is that, we're going to be living longer and longer in our society right now. Life expectancy right now, living up to 100 is no longer news anymore. And I believe that within the next 20 years, we'll probably live up to 120, 130. So having said that, if by the time you're 60 and you're not able to enjoy the intimacy that you once did when you were younger, you're going to live the half of your life without that. And so you will be, living a quality of life which must be different and much less than what you were before. So I want to be able to disseminate information that there is a treatment for ED. As well, there's also a treatment for women as well too. But that's why I wrote the book.
Wow, I was just thinking about that when you were saying that our life expectancy, 100 would be unimaginable for many people. But when you're saying 120, and you're right, if you're in your 60s, like I just turned 60, so that would mean that I would be, if I still had 60 more years to go, wow, that is a long time. If you had ED, that you would be missing out on a huge part of your life and everything. So with the platelets rich plasma, and they call this the P shot. So how, when you treat someone for ED, how long would it take for them to actually start to see results?
Right, that's a great question. So when after the injection, they will see result within 3 weeks, literally. It will, and some even sooner. But the peak result will be at 3 months. We usually do the P shot, and we also add shockwave therapy along with that. What shockwave therapy is using acoustic sound wave to create a vibrational treatment to the genital area. And what it does is that it creates more blood cells, more blood vessels in the area to work synergistically with the platelet-rich plasma. Platelet-rich plasma, or PRP, from your blood, actually, when it's injected into the area, help create more blood vessels. So when you create more blood vessels, you innately stimulate healing to the structure. So when you have blood, you have healing, you have life. As we know, blood is life. So when you have more blood flowing to the area starts healing, developing more blood vessels, and therefore the tissue surrounding it is becoming rejuvenated and regenerated.
Wow. So really, you're rejuvenating your basic body structures and growing more blood vessels and creating more new, like whatever is your inside tissues are and everything. I wanted to tell everyone a little bit more about your background, because not only are you a leading doctor in this area, but you also teach other people. And so what I find really interesting about your background, you have the bachelor's degree from the University of California, Berkeley, the medical doctorate from the University of Nevada School of Medicine, and then you went on to do internal medicine at the University of California, Irvine, and then your residency in physical medicine and rehabilitation at Baylor College of Medicine in Houston. And you've been an assistant professor at Baylor College of Medicine in Houston. Then you've taught physical medicine and rehabilitation to physicians in training before relocating to Fredericksburg, Virginia. And now you own the TRUONG Rehabilitation Center. And of course, you're board certified in physical medicine and rehabilitation, along with the electrodiagnostic medicine, and you have more than 20 years of experience. So this is amazing to me, and I've been lucky enough to meet you personally and learn a little bit more about you. And not only that, but you're also an ambassador for Women Entrepreneurs Day organization at the United Nations, and you are the 2018 Entrepreneur of the Year for your Chamber of Commerce. So how amazing is this, that you have this phenomenal background? Now you've written the book. So since you've written the book, and have you found that just educating people about this issue and that there's hope has opened some doors for more people coming to learn from you?
Certainly, yes, definitely. I think that when my book came out in March, within a week, we actually had more patients come in to see me, and we continue to be blessed with, the increased business. But certainly now, when I'm, being asked to teach and lecture, having the book really helped to give me credibility, but it's also something that I can use as a reference as well. And it certainly has brought me to be a leader in the field. and it certainly brought me more opportunities to teach as well. So it was a good thing to do, and I'm even considering writing another book next year.
What's your next book going to be?
I'm probably going to do an executive anti-aging book, where I feel that this is geared towards entrepreneurs and executives to give you the formula on how to maximize your work life, but also your personal life, and live the best quality of life you can have, and look great and feel great, and continue to have your intimate relationship as well. So these are my typical patients. My typical patients are business men and women who come and see me because they just don't feel well. They have a hard time concentrating. They're not as productive they used to be. They're usually in their late 40s or early 50s, and they have pain. They're exhausted. They can't sleep well. They need to maintain a certain work and lifestyle. And when I see that, I usually do blood work, and we normally address a hormone imbalance, which start to happen around like late 40s in men and women. When we address the hormones imbalance, and we address the stress hormones and balancing that, like cortisol, and everything else starts to fall into place. And then they get more productive sleep, and they have their focus back. They have more attention, more energy. And then we also work on a weight loss program as well. And I also offer, with the platelet-rich plasma, not only can it be used for ED, it can also be used for the face to get rid of wrinkles and to help you look younger, get rid of acne scars, and give you a youthful look. And it can also be used to enhance your cleavage. And we have a similar treatment to the P shot, like the O shot, is similar for the woman. So when I get my patient, feeling better, focusing better, being more productive, then, we focus on having them, look younger, and more productive life. So that's kind of like what I like to write the book about, is to how to live your best, be the best you in the best years of your life later on. So that way you can live another 60 years with the best quality of life, considering that we'll probably be living into 120, 130 in the next 20 years. I'm in the stem cell field, and every time I go to conferences, we have anti-aging measures to prevent diseases and to treat disease. And I believe that in the future, chronic diseases like diabetes or neurological disorders, Alzheimer, all that will eventually be treated.
Wow. Because that is something that makes what you do, you are more along the functional medicine. You treat the whole person instead of just looking at, pieces of what's going on with the person. Of all of the things that you do and the services, which one do you think is the one that is the most helpful to people? Because I know you cross many areas, even with acupuncture and massage therapy and the pain management and things like that. Is the platelet-rich plasma and the stem cells, what is going on in that area? Because it seems like I hear more about stem cells now than I even did a few years ago.
Well, yes, because, we're now more educated and we demand more. Like I said, we're living longer. We want to feel better. Before, you're 50, you're downhill, right? Now 50s is the new 30s, right? And it's not unusual to see somebody still working in their 70s. So we're living longer, we're expecting more, and we have the technology now to enable for us to have a longevity with better quality of life. And we're just at the tip of the iceberg with stem cells and PRP. And one of the things about that is that we know that surgery is not the answer. And we know that there are some limitations to that. And then with the opioid epidemic that's going on, that, we all want an alternative, a more natural alternative that does not create a chemical dependency or a disability like surgery. So that's why there's more stress now on stem cells and PRP. And stem cells and PRP has been around actually with horses for since like the late 90s. And the dentists were using it as implant into the jaw when they did surgeries in the early 2000s. And so it became popular with sports medicine and pain around, I believe, like mid-2000, about 2006. And now we're finding more and more the potential healing effect of stem cell, that you have stem cells in your body every day. It's your body heals itself, like your skin shed. If you cut yourself, you have your blood that goes into the area and heal that. If you have a little small fracture, that bone will heal. So stem cells are not something unusual. We have it in our body, but it's just that we have to bring the stem cell to the area to heal it. For instance, let me give you an example. Let's say you have a knee pain. Well, inside the knee, when you have arthritis in your knee, inside the knee, there's no blood flow. So there's no blood getting into that area to help heal this. So over time, it gets worse and worse. So with the stem cell, I just isolate the stem cell. I harvest the stem cell from your bone marrow or your fat. And also use the platelet-rich plasma, which has healing factors from the platelets, and then inject it into the knee to help start the healing process in the knee. So essentially, you're taking the good stuff in the body to put it in an area that cannot get the good stuff to start healing again. And we right now only know probably about 10% of the potential of the stem cell and the platelet-rich plasma, but yet now we can repair rotator cuff tears, we can repair elbow injuries, we can repair, tendon tears in the hips and the knees, and it can also repair and decrease pain in mild to moderate arthritis as well. So the key is to get treated early, so that way you can start the healing process early, whether it's in your knee or your hip or your shoulder. If you start early, the stem cell will do a great job. But if you wait until you can't walk anymore or it's too much pain, then it may not be a lot to repair. So that's one thing to know, is that the earlier you can fix something when it's mild, the more the improvement. But if you wait until when it's severe, it's very hard to reverse something that has already been damaged. And so I see that frequently in my practice. I see some patient that's been having hip pain for 10 years, and then now they can't walk in 5 steps, and they come in, but their joints are so much destroyed. We can't do anything about it except for them to get surgery. And then on another note, if I have someone that just had a mild, arthritis and is having pain like when he runs, then we can do something about that. So, with the technology of stem cells and PRP, I want your audience to know that, there is an alternative now to taking pain medicine or continuously popping in ibuprofen or Advil or prescription NSAID or anti-inflammatories, but they cause kidney problems and liver problems, not to mention elevating blood pressure, and it can even cause you to even have heart attacks. So, so when you find yourself popping a lot of ibuprofen, you really need to start looking at alternatives at this point. And I also want the audience to know that there is an alternative to surgery, and explore this option first before you consider surgery. But the big main point I want to stress is that, seek help early. You can benefit from the treatment a lot more if you start early. Does that make sense? Like, it's kind of like your car.
It makes a lot of sense.
Yeah.
Because what I was thinking,
yeah.
I was sitting here listening, and I was thinking, so really the message is, if you are having pain and it's your body telling you, hey, there's something going on here, and don't wait until you're bone on bone, or that you can't walk, or that your hip is totally gone. Go take the heed of your body telling you that you have something going on, and go get it checked out. So if somebody, what would it look like if somebody went in, what would the process be? Where would they start? Like, they would come in to see you, and what would the steps look like to come up with, I guess, a diagnosis, so that you could then come up with the correct treatment? What would that look like?
Often, yeah. Well, I would do a total evaluation with the history, how long you've had this, and what treatment have you had. I would also look at what your other medical problems are, what medication you're on. I would do a thorough exam, and depending upon your condition and your medical history and what your goals are. Because sometimes, patients come to me, and if they want to be able to run again, but they have severe arthritis, then I may not be able to get them to running again, but I may be able to say, hey, I can reduce your pain, so that way everyday life is not uncomfortable, but you won't be able to run again. So it all depends upon what the patient's goals are, what we're able to do, what is the patient's medical status, and what medication they're on, and what other medical conditions that they have had as well. And the saying is this, and this is true for everything, even when you have surgery or anything, is that the healthier you are when you have a procedure or surgery, the better you're going to be. And so, and that is what we observe, is that people respond better when their body respond better to stem cell therapy and PRP if you're in a healthier state. But if you are debilitated, you can't walk, and you take about 20 medication, and it's hard for you to breathe, and it's hard for you to take more than 10 steps, then you may not benefit as well. And that goes back to what I'm saying, is that, get evaluation and treatment early, and do not wait, until it gets really bad. But unfortunately, it's human nature, you don't seek help until it's very severe. And so, and I'm almost on the same boat, but I've learned now to listen to your body, because you have to realize that your pain mechanism is actually a protective mechanism. So when you are hurting, your body is saying, help,
Yes.
pay attention to me, pay attention to me here. And, it's a warning sign. It's no different than if you touch a hot object and your instinct is to withdraw away from that hot object to protect yourself, right?
Right.
So when your body is having pain, then, you need to listen to it and pay attention to it, and see if you can, get treatment for that as well. And, as we're talking about stem cells and PRP, I also want to mention that, there's now an explosion of this being used for aesthetic treatment as well, too. And I have alluded to that earlier, but we can use it not only for pain, but we can use it for the face and for the hair, to regrow hair again, for those women and men that have, falling out hair, thinning hair, or bald spots. We can use the same stem cells and PRP to regrow hair, to make hair thicker. And the amazing part about the regrowing hair is that it actually comes out the same color as your natural color. So if you're a little bit gray, the hair that's regrowth actually is your own natural color, and it works magic in women. And in men, it depends on on their condition. It does work well, but not as well as in women. And then it also works well for the face. So before you consider, getting surgery or for the face, the American Dermatology Journal has said that doing the vampire facial, which is using PRP and using microneedles on the face with the PRP, is far better than doing microdermal abrasion or doing the facial that you normally get. So it's something to consider, in that other aspect as well too. So really, we can put stem cell everywhere in your body because it's your own blood, and your body will. There's no adverse side effects, and it's almost none to zero downtime. I will do a treatment on a patient. I would do a vampire facial at lunchtime. One of my patients called the lunchtime facelift, where the patient go to work, they come to the office, the procedure takes about 30 minutes, and you're out of there, and all you look, it looks like you just had a little sunburn on the face, and you come back to work again. So it's amazing now what we can do with our own innate healing ability. We just got to tap into it, and we got to make sure that we keep ourselves healthy for, to live up to 120 and with the best quality of life that we can get.
Well, my dad is 91, and he told me, he goes, well, I'm going to live to be at least 100. And I said, well, Dad, I said, you can live up to be at least 120. He goes, oh, okay. That's his new goal, because he was just going by, what he thought. But wow. So basically, the cool thing about all of this is just like we've always been told, we have the ability within ourselves. And now with this technology, we can use our own blood to keep ourselves healthier and to look younger and to heal ourselves, because we now understand how to do that using our own stem cells and our own blood and everything. That's really phenomenal. And I'm glad that you mentioned the vampire facelift and the fact that, basically the hair regrowth. And for many women, luckily, I know that I personally haven't had that issue. But I know that there are women who do have that thinning hair issue, both men and women. But it's something that if you see those ads in the magazines, and those are kind of scary, the way that they portray how that they would have to create that. But how cool would it be to regrow your hair in your natural hair color? That would be pretty amazing. So if somebody wants to contact you and find out more about how to work with you, how can they do that?
Right. The best way is to go on our website. It is www.TRUONG Rehab. It's spelled TRUONG REHAB.com. And once you're there, you can get a copy of my book for free. If you go under the tab called Book, you can download the PDF of the book and read on it. And it's not only for men. I've actually wrote it for women and men because all women have loved ones that are men. And this will affect all men after the age of 60 in some mild, some very severe. And also under our website, you can find more information about stem cell therapy and PRP and the different services that we have, ranging from a treatment of arthritis and treatment of tendons and ligaments with PRP, to aesthetic treatment, to hormone replacement. We also do IV therapy as well for anti-aging and for weight loss and for immune diseases. And we at our facility, we have a one-stop shop where we have massage therapy and chiropractor and physical therapy as well. So when I created the practice, I wanted to be the mall of all anti-aging treatment. That way, patients just only need to know one place they need to go to for all their needs, from pain to looking younger to feeling better to having great sexuality. And I'm proud to say that we've actually reached that milestone at this point. But in our website, it will also have a contact. So if you have any questions or you'd like us to contact us more, there is a tab for contact us, and we just redesigned it. So I hope that people will find it useful.
I actually visited your website, and it's very easy to navigate, and there is a ton of really high quality educational material at truongrehab.com. So I think it's a great place if you're trying to educate yourself about PRP and ED and about all of the latest regenerative information and functional medicine, because that was one of the things I noticed about your website, is that everything you're doing is like the latest, most up-to-date information on medicine and what is working today, and so that you can avoid, if you can, the surgery or just taking pills that could lead you to addiction. So I think that's really important. So Dr. Truong, thank you so much for educating us today.
Yeah, thank you. And I look forward to talking to you some more.
Thank you. Everyone, this is Tammy Patzer. Go make it a beautiful day.
You've been listening to today's top health and wellness innovators and thought leaders on Optimal Health Radio. To get more solid health and wellness information, visit optimalhealthradio.com.